Okay, thanks everyone for joining us for our final webinar and networking series with this project that we have had with the Texas Department of State Health Services and their TEHDI, TEHDI program, the Texas Early Hearing Detection and Intervention Program. Texas Hands and Voices has entered into a project agreement with them to help in the networking and facilitating of connections and resources in your areas, which you've all been a part of over the last year. We have Dr. Karen Diddy and Dr. Sarah Wainscott, who are going to be presenting a case study for us today on system efficacy. It is incredibly eye-opening and fascinating to get to listen and watch this today. So we hope that you are going to learn great things from this and that you take away something to go back into the work that you do to help improve systems. So I am going to turn this over to Dr. Karen Diddy and Dr. Wainscott, and I will start sharing my screen and get that PowerPoint started.
Thank you. Welcome, everybody. We're excited to have you here. As she indicated, this will also be recorded and will be put up on our YouTube channel. But today we're going to be talking about improving our TEHDI system efficacy. And we're going to look at a really interesting case study, which I think you'll find fascinating. What is efficacy? Do you want me just to let you know the next slide or?
Yes, please.
Next slide, my dear. So what is efficacy? It's the ability to achieve a desired result. What desired result do we want? What have we been talking about? Providing services for children and their families with children who are deaf and hard of hearing, and helping them navigate the system and helping them get through the entire process. Next slide. So let's kind of review what our families and processes. Why did we learn it was challenging for Texas families? Well, usually because many of our families that are challenged are our most vulnerable. Families where language is not English, that's not their first language. And in our state, it's mostly Spanish. We deal with rural and low SES. Within that, I want to stress, we have major cities, but remember, we're like a small country. Texas is huge. And so there's a lot of areas that are underserved. Many of our families are uninsured. I believe we're about 70% Medicaid in the state of Texas for children. So it's pretty high number. And many are uneducated or uninformed. And that doesn't mean anything more than they're not familiar with hearing loss. As we learn, it's a low incidence. My captioning is hiding my PowerPoint. So it's invisible, it's variable, and it's also a developmental emergency. What do we mean by that? We mean that the first 3 years of a child's life are some of the most critical part for learning and like being a sponge for language. We call it the neuroplasticity of the brain. That's when the brain is just sucking in all kinds of knowledge, and we need to identify early. Before newborn hearing screening, children weren't identified till almost 2 to 3 years of age. And then oftentimes even later if they didn't have a significant hearing loss, because there's a variability in hearing loss. You can have anything from a mild to a profound hearing loss. We talked about the standard of care that the Joint Committee for Infant Hearing recommended, 136, where the first month, we want the child to be screened, and most of that happens in the hospital, but sometimes outpatient, and sometimes the children that don't pass need a second screen. So we want all that to occur within the first month of that child's life. And then if they continue to not pass the screening, then we go on to do a diagnostic evaluation. And we talked a little bit about what that standard of care is, and we won't go into that today, but you can look at previous episodes of our journey through webinars to learn more about what that standard of care should be for a diagnostic evaluation by a pediatric audiologist. Then by 6 months, sooner if at all possible, but hearing aids and early intervention to begin. we would prefer it to occur even earlier than 6 months, but certainly no later than 6 months. Remember, we're working with this developmental emergency. We're trying to get this child to get the language and help families have an opportunity to make the decisions they need to make. So there, we also want to connect them to the critical connections. Texas has a wealth of connections, but it's just not as well known. And that's what we're advocating that you do, is to be sure to share this information with all of your families. So there's Texas Hands and Voices, which all of us on the call represent. There's the Texas Early Hearing Detection and Intervention, who is our statewide resource for learning more about early hearing detection and intervention. They develop the rules and the standards. And then there's the statewide outsource center, which provides a wealth of information for children and their families, educational materials, resources, and opportunities for training. And there's the regional day school for the deaf. So we do have things out there and programs out there to help these families, but these families aren't always aware. And so what have we done these last many months? We've talked about all of these areas and how you can better advocate and help your families learn more about that. So the next slide.
This is Sarah. Just to clarify, that statewide outreach center, and most of you guys are already familiar, but in case you're not, it is associated with the Texas School for the Deaf, right?
Yes,
and those
yes.
regional day school programs exist within communities throughout our state. So we've got both the regional and the state resources involved.
Good clarification. And again, I want you to consider going back, because we've come a long way over this last year, and some of this may be review for some of you, and it may be new information for others. So I would gladly encourage you to look at some of those previous webinars that we've been doing. And what's special about them, they're very Texas specific, and that's really important for a small country like we have. So we talk about coaching, providing clear, parent-friendly explanations, unbiased information. And that's really quite critical. All of us come to the table with some kind of bias. A parent, a professional, an audiologist, a physician. But what's important is that information is provided to the family in an unbiased manner. So it's the family's decision that makes directs the course of intervention. Timely referrals and supports, the vetted resources. We've really stressed a lot, and we've provided you information on where you can get well-vetted resources for your families, websites that have proven to be unbiased but provide the information for families in a number of different aspects. So we've provided that for you, in addition to the Texas websites that are available with the different advocacy groups we've talked about. How to advocate for families. We've coached you talking about system advocacy, individual advocacy, coaching parents for advocacy, helping them be their child's best advocate so that they can make the decision that's best for their family. So we've covered a lot of this topic and over these last many months, and some of it, again, will be review, some of it will be new, but what I want to encourage you, and the reason we've recorded these over these last many months, is that if you go, I remember a discussion about that standard of care. Oh, I remember that discussion about the laws in Texas. Oh, what does advocacy truly mean? All of those have been done over these last many months to prepare you to be the best coach for the families that you meet, because we know, and we want to be reminded, deafness and hearing loss is a low incident population. It's a lot to us who work in the field, but it's a low incident population. And so physicians, educators, people in the field don't always understand the dynamics. And so what we want you to do is be your family's best advocate and help them to achieve the goals they wish for their family and for their children. We've got an interesting case. Let's go to the next slide. And here we're going to meet Macy. And Sarah's going to pick it up at this point and tell us a little bit about it.
All right, so this is a family that we encountered, and I want to share their story, but really want this to be interactive and want you to use all that knowledge that Karen just talked about to make some application. And so here's the deal. If you are or are not familiar with your little Zoom screen there, if you look at the bottom, you can see reaction. So this is your time to like use all those whack emojis that you never get to use. Or you could, we want you to push the buzzer when I'm going to tell the story. When you hear something that, hey, that's not right, that's a problem, this does not meet standard of care, hit your buzzer, raise your hand, put a thumbs down, do whatever it is to indicate to us that you understand that this is not the way that it should go. So I'm going to open this up on my screen. So I'm going to tell you a little bit about Macy. This is a family that we encountered just this summer. And I say that specifically to let you know that this is a real case happening in real time within our state. And so the family is in a resource-rich area of Texas. This is not a family living in some of the areas where you guys are. This is a resource-rich area of Texas. They're white. They're English speaking, they're well educated, and they're familiar with navigating systems and services from a medical perspective. They had another child who was critically ill. So they were familiar again with how to navigate things with insurance and with systems and with services. This little girl was screened at birth and she referred. She went on and referred on her second screen. And they were referred to diagnostic audiology, and the family followed up. And at that initial audiology appointment, she was told that the test was not good and that she needed to come back in a few months. So can we stop screen share for a minute, Michaela, so that we can see any emojis that might pop up? Anybody see any problems so far? It's not good. Come back in a few months. And at a regular follow-up with her pediatrician, mom asked about that hearing testing, and the physician did 2 tests. The mom doesn't know exactly what they are, but the physician says, hey, she passed 1 test, the other she didn't pass, but he assures her that the hearing is fine because she's turning to sounds and everything looks good. So maybe another thumbs down or emoji or something not okay there. Mom notes that the little girl is not developing language like her other child, and she takes that child she takes her daughter to Child Find. You guys are all familiar with Child Find, and at this point, she's communicating with Child Find, and they do a screening, and they say, "We think this child is autistic. We are identifying her as having autism," and they refer her for a full-on assessment. But mom continues to think, I think there's something wrong with hearing. So she goes to another pediatrician. Again, mom's navigating all this, refers her for additional testing. Mom's not sure why the other testing wasn't sufficient. But finally she gets to an audiologist. And at this point, the child's 2 and she's not talking. But she likes to jabber and she kind of sings along. Her mom said, hey, she sings Wheels on the Bus all the time, but she doesn't sing any of the words. But she kind of likes the melody, She's tested in the booth. And at this point they say, and like in the hearing booth, the audiological booth, she's 2, so they're not doing those ABRs at this point. She has a moderate to severe bilateral hearing loss, both ears, right? Hearing loss. And she's fit with hearing aids at that point. So she's 2, right? Again, think about what may not be going right at this point. And the ENT that sees her tells mom, just whatever you do, don't sign with the child because that's going to hurt her ability to learn spoken language. And because of that, you should not enroll in ECI or those RDSPD services because, again, that's going to hurt her ability to use spoken language. She's got a moderate to severe loss. She has potential, but those services are going to take her down the wrong path. And so that was, yes.
This is Michaela. Just want to let you know there were lots of like wows and shocks as you mentioned that part of Macy's journey. So wanted to point that out.
Yeah, and this is a well-respected ENT in that community. Everybody knows this person well, and there's a limited number of folks that see these children. So he's somebody that people go to regularly. And the mom is following along. She's doing what she's supposed to be doing. And so, the family enrolls the child in a private preschool. That's what was advised. Now, the staff there, they don't use the hearing aids because they're worried about, like, hey, what happens if she loses them? And Macy, like, she's coming home from school every day, crying, and often with bite marks. So this is not going well. And at the same time, they have another child who's critically ill who continues to do poorly. And so they're navigating lots of things and things that are complicated that they can't communicate effectively to this child. There is 1 month left of school, and the mom says, we're done, and I'm just going to take her to the school for the deaf. I'm going to take her to that regional day school. There's a hard of hearing teacher there, engages with the family. The little girl loves her, and she's eager to go every day. And they do use sign language, and the mom and dad get an app on their phone so they can start to learn some sign language too. But the little girl's also now wearing her hearing aids every day and is starting to pick up spoken language as well. The summer progresses and the family enrolls in a language program that's like at a local university nearby. And she gets lots of resources that she didn't have, for the first 3.5 years, because she's 3.5 now. And this includes the Family Signs program from the State Outreach Center, Texas Hands and Voices, as well as just some basic coaching on language that's spoken as well as language that's signed. The little girl's picking things up quickly. There's a significant delay, though. There's no
Sarah?
indicators. Yes.
Again, sorry, this is Michaela. Just want to interrupt here. There was lots of thumbs up and heart signaling when we started to see Macy's journey improve.
Thank goodness, yes. No indicators of autism. And so this summer, she also she joined a community soccer
Can you
program.
say that again? No indicators of
No
autism.
indicators of autism. Nope. She's in a community soccer program. She loves the music, and mom's like, she's starting to pretend at home, which is kind of fun. So all those things. So we're ready now to switch back to the shared screen. And we can go to the next slide. And so we want to review that case, because, we can all say, oh my gosh, things didn't go like they should. But we also want to learn from our mistakes, please.
Sorry,
and
Sarah,
so,
may I stop you 1 second?
Yeah.
Gregoria, I see that you have your hand raised. Do you have a question and you want to engage? Maybe that was a reaction. So
That's
if you
fine. That's
do,
fine.
let us know. Okay.
All right, here we go. So let's start at the beginning of the case. Go ahead, Michaela. Let's start, and we're going to walk through each stage, and we're going to say, hey, ma'am, what could we have done differently? And so I'm going to ask some questions, and at this point, we really do want you to engage. So we have 26 of us, and so Michaela, what is your call? Should we just speak out? Do you want to use the chat? What do you think?
Maybe we can use the chat and give everybody.
Fine. That's fine. Everybody gets an opportunity. All right. So first question, was the family in a vulnerable population? Karen walked through those families that we worry about not getting what they needed. But we talked about socioeconomic status, low income, being rural, all of those things. No. No, this family was not there. And in fact, they'd already navigated systems and services that were pretty complicated. What about the screening process? Did that follow our standard of care? And Jennifer, you're right about audiology, but let's start with screening. We're going to walk through each step. Right? What about the screening? Did that seem to go like it was supposed to? It was too long of a wait time, yeah. And here's the deal. We know that audiology didn't go well. You guys are already alluding to that. But we don't know why. So what we would like to happen, and we don't know the story here, is as that family goes into that diagnostic audiology piece, they would be prepped, right? And so the idea of being prepped is to say, hey, you're going to go for this test. It's going to really help if your baby can sleep. And so, don't feed her that day. Right before you go to the appointment, don't let her take a nap in the car. Put on something that's really comfortable so that we can get those little sticky electrodes on her and that she can sleep naturally and we can get a good measurement. We don't know if that happened. We don't know what information was given to her about kind of next steps because mom knew what the next step was, the immediate next step, but she didn't seem to have a sense of the whole system, right?
And that's a matter of training as well, isn't it? We talked about how important it is, and that there's actually training modules to train screeners on how to communicate better with their families, and it's basically the handoff. You start with the first group, the screening group, and you're handing off now to audiology. But that parent needs to have an understanding. And we're not talking a huge number of kids that this screener has to stop and talk to. So yeah, it is a critical stage, and we don't know how well she was communicated.
And honestly, most of you guys are not going to be screeners. But what we do want you to be is the safety net to recognize when they didn't get the information they may have needed at the screener. So when you do encounter them, you can coach them about what they should know, right? And certainly we want, like Karen said, consistency, quality training across those screeners.
And your birthing hospitals in your area, don't you? I think it's good to become familiar. Who's managing the screening at the hospital near you? Develop a nice relationship with them so that you can ask questions when needed.
Yeah. Did the family get the appropriate referrals and schedule? What do you guys think? Did they get referral from screening to audiology? And we don't know. I mean, it looks like they got to that first audiologist, right? We talked about that Eddie Pals, that would be a helpful resource in terms of getting you from one place to the other. And does this meet our standard of care? I mean, thumbs up, thumbs down, maybe? What do you think? And Karen, I know that you wanted to chat about what could have been done differently. Do you guys have any ideas? Yeah.
Yep, it's important to listen to parent. One of the largest, somebody wrote in here, no parent continued to have concerns. One of the greatest risk factors we know of, all those risk factors we talked about, risk factors for hearing loss, is parental concern. And so somebody should have listened to this parent. And the second thing was, what else about the audiologist? What about a return visit? What happened there?
Well, Karen, let's move to that next screen because this is screening. Okay. Let's go to audiology and we can move right on.
Oh, sure.
Yeah. So this is that initial audiology encounter. And our question we've already asked, did she know what to do, how to prepare for that test? Did she know what that test was measuring and why it couldn't be completed? Because that would have been helpful information to us. And it seems like she didn't. And what about the follow-up plan? What do you know about that follow-up timing? When they say come back in a few months, was that appropriate and timely? What are you guys' thoughts there?
Remember the JCIH recommendations. What were they? What are they?
Yeah, do you remember 136, what those numbers stand for?
Jennifer made a comment. Sorry, this is Michaela. Jennifer made a comment that this needs aggressive management.
Absolutely.
Yeah, and remember our 136. So screening at 1 month, that seemed to have happened. We want diagnosis by 3 months. This is the place where the diagnosis happens. So you assume she's older than a day old by the time she gets to this first one. So when the audiologist says, I didn't get a good test, come back in a few months, we're going to pass that 3 months. We're going to be out of compliance pretty quickly. And this becomes a big deal for a number of reasons. One, the early identification that we were talking about, But once that baby gets a little bit older, we can't do that natural sleep EBR anymore. We have to use sedation. We have to, and not anesthesia, but we're giving that baby a little chloral hydrate, a little Benadryl-ish solution to help that baby sleep. And that adds a whole nother layer of angst to the mother, requirement of the audiologist. And frankly, it's just harder to get that appointment. So every time we delay those services, we are making them even less accessible. Right?
And sometimes that breakdown is because we do have a shortage of pediatric audiologists. We talked about that over these last many months. So again, it's so important that each stage in the process, like the screener informing the parent about a sleepy baby, and the audiology people who were scheduling should have also sent a note to mom. Be sure your baby is sleepy, so there's no delay, because there's really no good excuse short of equipment breakdown that audiologist can't get a good evaluation at such a very young age with a good sleepy baby. It's a very simple process. There's always the issues, I know, but generally speaking, it's a very simple process. No need to delay.
Yeah. So a few months is not okay. Go ahead, Michaela. Yeah, you're right. Exactly. Don't push that scheduling back on the patient. Set up a follow-up appointment at that time. Absolutely. So we get to that first pediatrician. Our question, did the mom understand what the testing was done, what testing was completed by that pediatrician? What's the problem there?
And if you're having trouble with the emojis, just type in your thoughts. That's good. We're following them closely.
Yeah, it was unclear, right? She didn't understand why the first test at the audiologist couldn't be completed. She certainly didn't understand what the second physician was. And remember, the average pediatrician sees 2 to 3 children that are deaf or hard of hearing over the course of their career. And so when they go to somebody in a white coat, they are expecting an expert. But that's not exactly what they tend to get when we're dealing with somebody who has a child with a hearing loss. I'm going to reiterate again that this family is in a metro area that is resource rich. This was not in the middle of nowhere. This is a physician that should have known better. One of the questions that we have internally is, were there any results from the screening and the diagnosis reported to TEHDI? We did not, because of privacy issues, take that family's information and run it back through to, that wouldn't have been okay. But that is a curiosity that we have. Were these results reported to TEHDI? Because that would have been another safety net for the family. And because that didn't happen, our assumption is probably they weren't reported.
And the physician, what did he say about the child's response to sound? And how could that have misled the family?
And what are your thoughts about the developmental emergency piece?
Remember, we discussed about the variability in hearing loss, right? We talked about that even just a little bit ago, how you can range from a mild to a profound hearing loss. So you can certainly see how a child can confuse you. And children, as we know, babble until 6 months of age. So maybe what could this pediatrician have done differently?
Any thoughts on that pediatrician encounter? Yeah, auditory detection doesn't indicate no hearing loss. That ECI referral, that's a good point. That ECI referral, remember, can be initiated from the point of a failed screening for the very purpose of helping them navigate systems and services. And so that didn't happen.
Exactly.
Yeah. a referral to an ECI or local services for follow-up and support. One of the things that, and you're absolutely right for that. One of the things that we reiterate, and this is partly because this is who we are, is the critical role of family-to-family support. And so one of the things that we would like to see from the beginning, even at that referral on that screening piece, is for that family to be connected with somebody like Tracy and Lana and Paulina and Michaela, people that you see here that coach and guide parents. They, unlike the physician that only sees 2 of these kids in a career, this is what they do. And they are trained and skilled and experienced at saying, hey, I think you need to ask again. I think you need more information. This is how you prepare. These are the questions to ask. And so just the miss of not having that parent-to-parent support that, again, would have been a safety net for this family. Yeah. Go ahead, Michaela. Child find, right? And so when we talk about child find, this isn't our typical target when we are having these discussions. We talked about screening and audiology and ECI, and child find is a little different. We understand that this is a federally funded program that families typically access because they connect with their local education agency, their school, and they say, hey, something's not right with my kid. I need somebody to check this out, right? And so we would have liked, just like you said, for her to have gotten to ECI for this to happen, but it didn't. And the mom took the initiative. She goes to her local education agency. She goes to Child Find and says, I think I have a problem. And so we would like to know, did that case history that they took include information about those hearing concerns? And was there data available through that TEHDI system that could have said, hey, this is a problem? Was the person who completed that autism screening, were they familiar at all with children that had differences in hearing? What are your thoughts on breakdowns that happened at Child Find? Go ahead.
Basically, what should have been done differently? What the TEHDI MIS, remember that? That's the area we put in the screening test results, the diagnostic test results. I feel like there's a chance that wasn't entered. So the individuals that are working with this family didn't know to access it, to have a better understanding.
And I also think that as systems and services, we need to do a better job of communicating, like Karen said, that low incidence nature of this population. So for somebody that intakes a child with that child find, one of the things that they're required to do is looking at sensory issues, hearing and vision, and to know that there were already some red flags there. That might have helped her to better understand whether or not what they were seeing was autism or whether or not what they were seeing was hearing loss, or both. But remember that because this child is turning to things, she's got a moderate to severe hearing level. So she's responding, and it is more difficult to identify immediately from somebody that's unfamiliar with a population that she doesn't hear. Jennifer, you're absolutely right. We have to rule out hearing loss before we make any of those diagnoses.
Right.
Autism, communication delay, any of those things. And so hearing is one of those things we're supposed to look at the very beginning. And Angela uses that term differential diagnosis. And we use that when we're trying to say, man, these things can look kind of the same, but they can also be kind of different. So we need to be able to separate out. And we see that. Some of the features of children that are deaf and hard of hearing look like a child that's ADHD or that's autistic or on the spectrum on some level, or has a learning disability, or is a second language learner. You know, they're not responding to questions, they're not alerting, their communication is slow to develop. And we have to be able to say, hey, what are the similarities and what are the differences, to do exactly what she talked about, a differential diagnosis. And while your average daycare provider maybe can't do that, certainly the person who's doing the screening at Child Find, that's part of her job. Yeah.
And something else we learned over these last many months is that there's such a thing as late onset hearing loss as well. So if a child isn't developing normally, but they feel like the hearing test was correct in the beginning, in this case, obviously not, it's called a cross-check principle. Everybody checks each other. And so you go back to say, might need to do more testing about this just to be sure it's ruled out, because what was done was a screen at a pediatrician's office. There was not, at this point, and if I'm correct, Sarah, there was not even a full diagnostic done yet.
Well, this is at child find. This point was at child find. But you're right, at this point, we don't have a full diagnosis.
History,
And so that mom is not going in saying she has a hearing loss. The mom is going in saying, we had some hearing concerns, but our doctor says it's okay. Yeah, and then the mom goes to a second doctor. So let's go there, Michaela.
This is Michaela. Sarah, also want to point out that Jennifer notes that, progressive hearing loss can also happen.
Right.
Yeah, you're absolutely right. What we know that at birth, we have 2 to 3 per 1,000 have a hearing loss. By the time they're 4, it's 4 to 6 per 1,000. It's doubled. So those numbers are still small. It's still low incidence, just like Karen said. But this is why we need those people that are on the periphery to be hyper vigilant. Passing at one point doesn't equal a pass for life. We want to continue to monitor, particularly those kids are at high risk. This child's not developed language at 2. She should be on somebody's radar. So mom leaves the pediatrician she was at and she finds a new medical home, right? And so the questions are, was mom's concern, were mom's concerns addressed at this point? And was the family well informed? Did they get the appropriate referrals for that appointment? What are your thoughts on that next step?
And Sarah, can you remind us what age the child was at this point?
Yeah, at this point, the child is, she is 2.
2. So what should have been done differently?
So the mom's coming in, she's saying, hey, she referred on the hearing screening. We went to audiology. They couldn't get a test. We went to another pediatrician. They said they're pretty sure that she hears. And now we have a screening that says they suspect autism. And she shows up at the pediatrician and he does say, we need a hearing test, but it's a different kind of hearing test than you had before. Mom's not sure what was wrong with the old hearing test and why that wasn't okay. So they're starting over and now they go to the ENT. Is there something that that medical home could have done better? Absolutely. They could have taken some time to explain. Yeah. I have a really nice, actually, perhaps as we push this back out, we could use this, have this chart too. And it was put together a number of years ago through TEHDI, but it really outlines in a really clear, parent-friendly format the different types of tests and why we do them. What's the difference between an ABR and a test in the booth? But something that's simple and parent-friendly should have been provided to that family. Yeah, why they needed updated why they needed updated testing and what hearing tests look like at various ages, right? The ABR is something we hope to have at 3 months. She's 2 now. So yeah, it looks really different.
And it goes back to what we talked about, communicating clearly to the parent, making sure you've spoken clearly enough the parent understands what those true next steps are. And I think we should be reminded, this is not a family who's uneducated. They're navigating a very difficult course with their other child. They're willing to do whatever it takes. But how well did we communicate the test results?
All right, let's go to the next step, Michaela. So now we're at ENT and audiology, right? Does the mom understand the hearing results and test implications? I will let you know that I'm the one that engaged with this mom when we encountered her, and I asked her to bring her audiogram with her And she brought every piece of paper she had because she didn't know what the audiogram was. And her report was, I don't understand what this means. Nobody went over it with me, which may be true. It may not be true. What we know is that hearing something once is not the same as understanding it, right? And she was given a lot of information at that point. So having multiple people, again, that parent guide is crucial to help coach her as she develops an understanding. But I will tell you, when I encountered her, and at that point, the child is 3 and a little bit more, she still didn't understand the implications of that hearing loss. You're right. You're right, Catherine. I mean, true, her understanding wasn't there. Something was lost, regardless of who did that test. And
the white coat thing.
Yeah.
That these professionals who decide, well, the child does pass the hearing, with whatever test they did in the pediatrician's office. The person who assesses for autism knows the difference between hearing loss and autism. Those kinds of things. You make the assumption oftentimes. And you'd like to think all professionals are good at this, but it comes back again to what we've said, that low incident population. They just don't always work with children who are deaf or hard of hearing.
And so the amplification gets on her right about a little after her 2nd birthday. And I misspoke. The little girl is 3.5 now. We also had the season in daycare, which I discounted. And so she's a little over 2 at this point. She gets her amplification. Is that on time? Do you remember our target? What is our target age for amplification? Do you remember 136? Yeah, we want it by 6 months. Now, we want it earlier. And to be clear, we don't have to wait till earlier. We can put aids on babies and routinely do at 6 weeks, sometimes even earlier. But certainly the research indicates that 6 months, if we can have it on by 6 months or earlier, that's a game changer. But every month I delay after that, we've got significant developmental differences, right? In terms of our language and potentially our learning. So 2 years is not great. That's not what we want. Did the mom get appropriate referrals and unbiased information? What's your thought on that? Unbiased information? No.
Big no.
And that's a problem. You certainly we are hands and voices. Clearly, we have a really specific filter about what we believe about communication and family options. But I would know that the information that was restricted from this family did not simply include communication options, which are huge, but communicating to the family to decline services that could have been really helpful, from, in my opinion, is unethical, to veer a family away from services, to show them all the services and to say, this is what your options are. You can make a choice, but that's not what happened, right? Any other questions or comments, suggestions? And I am being genuine when I say suggestions. There are a limited number of providers. And so if we know that this is a provider that takes her insurance, that's in her community, that does pediatric hearing aids, and we know that this is the information that that family is going to receive, and there are people on this call that have engaged with this physician as a practitioner. And so it's tricky. How do you address that? I'm not sure that we're going to introduce this physician to information and he's going to somehow see the light. I don't think that's going to happen. But there need to be other people communicating with that family so that the person in the white coat is, and that particular one, is not the only voice they hear. Again, that parent-to-parent support is critical.
And if this family had been connected with some of these other resources even before seeing this ENT, they may have heard the physician's comments, but will have already been informed maybe going to vetted websites and learning more about concerns for hearing loss. They may have learned a little bit more and taken it for what it was stated. It was a bias.
And I do want to note, Catherine talked about, hey, sometimes you have to be careful with that parent report. They're overwhelmed and they're scared and they only heard a small portion. And I don't know how much time was needed for that other child. But the referral to ECI, they could have guided the family better and faster. I absolutely think you're right. And I do think they may have gotten more information about the audiogram. Like I said, we've got several people on our call that have worked with this physician professionally. And he has a spiel that he gives about the dangers of sign language. So I'm confident that that was accurate.
But the fact that the physician said that clearly goes back to what we talked about, communicating information in an unbiased manner. And that certainly wasn't done, regardless of maybe information that parent missed previously.
Yeah, and Marisol
right,
has a point that goes back to that idea of why that coaching that family is so important. Coaching the family how to advocate, coaching the family how to ask questions. And we've already made the point that that this was an educated family. This was an English-speaking family. This was a family that knew how to navigate systems and services. And I think that's part of our point. If it was this hard for this family, what about all those other families, right?
Particularly written English is a second language, not a first language.
Yeah. Go ahead, Michaela. What about the community? And want to be careful about pointing fingers. But this is part of the point of this project. Can we as a broader community be more aware to be, again, a safety net for these families? So we noted that the family was not connected with a family-based organization, which we would say should be a first step and is critical. But there were so many free resources that they weren't accessing. So they're sitting there on their phone trying to learn sign language. There are free sign language classes online with a real person through the State Outreach Center, the Family Signs Program. They didn't plug into that. ECI could have helped them navigate systems and services, showed up with home visits, helped identify providers. They didn't have access to that. And that regional day school program for the deaf, certainly it worked out that she loved that placement. Even if she didn't love it, she could have gone to visit it and made a decision for herself, or she could have connected with that regional day school program and they could have had an itinerant person that came in and served and coached that daycare. But all of those collaborations didn't happen because those connections weren't made. That preschool was not equipped to provide inclusive support. So we want to do a better job of coaching other individuals that provide daycare and preschool. In fact, Paulina and I are headed to Region 1 tomorrow to do that very thing. The family wasn't equipped to make informed decisions. They were put on different pathways, but they weren't given choices, and they didn't own those decisions. Any comments on that or questions, suggestions, please? One thing I would want to note, just because of the timeline when we encountered this family, there is a great program that's provided by our State Outreach Center. It's called Family Weekend Retreat. And the families get to go to the School for the Deaf. They get to stay there for several days. They meet with other families. There's activity for the kids. There are workshops for the parents, lots of connections. They didn't get to participate. The Family Weekend Retreat was full. They missed the deadline because we hadn't encountered them before then. There were lots of opportunities along the way that were missed. If the only thing they had done was connect with the Hands and Voices website, they would have seen more resources, but even that wasn't provided to them. Yeah, and maybe they could have Googled, found supports. And I think this goes back to what Karen's talking about, that idea of vetted resources, right? And you're right, not that they should have to. The other thing is, and this is sticky, as the mom is sharing these things, she says, maybe if we hadn't been focused on the critical health issues of our other child, maybe things would have come out differently. Maybe it's my fault. Maybe we put this our daughter on the back burner.
I think that
Wow.
takes us to the next slide, right?
Yeah, I'm not even sure. Go ahead.
Was there a breakdown with the family?
Yeah, was there a breakdown with the family? And yeah, I think I'm with you. Could they have Googled? That's tricky because vetted resources, that's a hard thing. And it's so much more helpful when we have a filter. And we would have liked it to have happened sooner. At what point were they effective in their advocacy? I would say that she did what she was told. Yeah. We would have liked, like we said, that parent guide to have been involved from the beginning. We talked about the resources that they missed out on, and the fact that there are other things that complicated this family's journey, but there are things that complicate every family's journey, right? All of you are part of a family. You know, and encounter families every day. You know that there are multiple things, not always a critical ill child, but other things that you're grappling with at the same time.
And these families don't know what they don't know. So that first audiologist, when they weren't able to get the test results, rather than waiting several months, explained the need to getting this test done sooner than later. And how oftentimes families will go home when there's that many months that pass, hit a few pans and pots, their child's turning, they think everything's fine. I mean, there's so many things that can come into play when there's this huge delay in providing the appropriate services for a family. Again, trusting that the professional they saw gave them the right advice. And that's a tragedy right there.
I think, and to Catherine's question, when the professional has already put you on the alert, somebody's going to try to lead you down this path, don't listen. It makes it difficult for you to filter information in a critical way. Yeah. I remember working with a family and we were talking about different approaches to communication. And she was talking about a provider that was leading her one specific way and giving her one kind of information. And she said, I just wanted to shake that lady and tell her it's not a religion. And I think that's the message that we need to hear, is that it's okay. And Hands and Voices, we talk about this. It's okay to have a personal belief system, and it's okay for us to make choices. Michaela and I have daughters that are the same age, and my guess is their audiograms look pretty much the same. We've made different decisions for our daughters, and they have different versions of success. But we both had choices that we made deliberately, and want other families to have the same thing. So what are the consequences? She's 3.5 now. Her listening age, and for those of you who are less familiar, when we look at language of children that are deaf and hard of hearing, particularly spoken language, we talk about how many months have they had listening, because it's not fair if we're looking at language to compare to what a 3.5-year-old does. She's only had her hearing aids for 18 months. So she has the language of an 18-month-old, but she's going to be 4 in a few months, and she's going to be going to kindergarten this time next year, and she's not ready. And so there are some consequences: linguistic, cognitive, social, emotional, school readiness, family impact. So it's great that she loves to sing. It's great that she's in soccer. It's great that she's going to be at the regional day school for another year, and she has a teacher that she loves, and she has friends, all those good things. But that doesn't mean there weren't any consequences, right? So any takeaways that you have, any suggestions? What are your thoughts as we kind of get to the end here?
And we want to stress this is a current child and today's real time that this happened.
And I'll tell you that I do some work at that regional day program. There's another kid that sits on the other side of the snack table whose story's not that different, right? Yeah, so just to reiterate that it's a challenge. And it's not, when we read the story, we think, oh crap, but we also don't think this never happens. That's an outlier. That's not what we're thinking.
Not at all. And that's why we've done these webinars, so that you can understand better than most. And we're really grateful that you've been consistently coming and learning and listening to our rants and raves, you know, based on a small incident population. But that incident population, we can make a huge difference. We know we can. That's why we do newborn hearing screening. But without following the steps, the standard of care that we can represent, and in a difficult state. It's a difficult state because it's huge. Not because we have uneducated professionals. It's just huge. And so it's hard to get services the way it should be. We all need to be there as a safety net for these families who may have fallen through the cracks.
This is Michaela. I'm going to stop the recording. Give me 1 second.
Thank you,
Thank
Sylvia.
you so much, Dr. Diddy and Dr. Wainscott, for sharing Macy's story. Stay with us. I'm just going to stop this portion.
Thank you, Sylvia, for your comments about